Hello, welcome to my channel. My name is Nurse Pauline RN. I will be uploading my videos on Tuesdays and Thursdays Eastern Standard Time. First of all, I hope you're all keeping well. Thanks for all your comments and thanks for subscribing to my channel. The goal of my channel is to assist nursing students to pass their fundamentals of nursing exam. Today we're going to be talking about therapeutic communication, and I have here a lot of information that will assist you in your exam. Therapeutic communication is verbal or nonverbal. Verbal means spoken words. Nonverbal means body language, gestures, or postures. Active listening requires concentration, should be focused, paying attention. Block out distractions. There are 4 phases to a therapeutic communication. The first one is your pre-interaction phase. The second is your orientation phase. The third is your working phase. The fourth is your termination phase. Ways to improve communication: listen without interrupting the sender. Show empathy at all times. Stay focused. Do not force patient to continue if patient becomes anxious or wishes to change the subject. Use body language that indicates concern or interest. Touch patient if seems appropriate. Lean forward. Listening by maintaining eye contact if culturally accepted. Some cultures do not maintain eye contact. In a therapeutic relationship, it's a working relationship based on trust, empathy, getting to know the patient. It is focused on patient's needs and concerns and spiritual needs through nurse's knowledge and skills. The nurse uses limited self-disclosure as means to connect with her patients. The nurse needs to develop a rapport with her patients. The nurse needs to develop trust with her patients. Ask questions to clarify unclear messages. Do not interrupt until sender has completed messages. Provide a quiet environment without distraction. Decrease noise level of equipment. Be convincing when communicating to your patients. Offer factual information to decrease anxiety. Do not offer opinions. Reflect thoughts by rephrasing questions and contents. When delegating tasks to others, give clear, concise messages. Include desired results and time for completion of tasks. Avoid long explanations. Avoid unclear and misleading messages. Silence gives patients time to think and respond. Be non-judgmental. Avoid medical terminology patients do not understand. Use simple communication to your patients. Use open-ended questions. Avoid close-ended questions. Avoid aggressive behavior, one nurse to the other. Avoid violence in the workplace. Aphasia is a loss of ability to understand or express speech due to stroke, brain injury, or trauma. Interpersonal communication occurs between two or more people. Small group communication, two or more people, example in your staff meetings, teaching sessions, or support groups. Group dynamics involves how individual group members relates to each other. Social relationships differs from therapeutic relationship. Both is focused on both participants. The goal is to meet one's own needs. Self-talk can be positive because it can affect the nurse's behavior and can enhance or distract from positive interactions. Children use calm, quiet, friendly voice and are responsive to nonverbal messages. Children may become frightened by movements, unexpected, or gestures. The elderly may need more time to think, to answer questions. If patients are hard of hearing, use pleasant, normal voice to speak slowly. Use gentle voice. Stick to one topic at a time. Congruent means an agreement, a style of speaking that remains harmonious with feelings being experienced. This is a test question. Incongruent communication, person's words do not match person's nonverbal communication cues. Personal space is 6 feet. In a therapeutic communication, we can have barriers, and barriers leads to obstruction in communication. Example of barriers are language barriers, cultural differences, setting in which care provided increases the workload and restrict nurses from discussing patients' concerns effectively. In telephone communications to your doctors, one nurse to the other, we use the SBAR. This is a communication tool. S stands for situation of patients. B stands for background of your patients. A stands for assessments and diagnostics of your patients. R stands for recommendation of your patients. Before you speak to the doctors on the phone, gather all your information, your diagnostics, especially your lab values. If your potassium, calcium, magnesium is low, let the doctor know these can all be replaced within few minutes. The doctors will give you an order for replacements. The WBC is elevated. We need antibiotics, blood cultures to be ordered. Blood pressure elevated. We may need more blood pressure aboard. Pain meds not working. We may need more pain medicine or change of pain medicine to be ordered. Let the doctor know what's happening. Students who participate in telephone conversation, a registered nurse has to be present during the telephone call with the doctor. Perception of your patient is your preconceived attitudes of your patients, which affects your ability to listen. In your pre-interaction phase of communication, this is your handoff is an example. In a handoff, we need the state to communicate one nurse to another. We're talking about the state of present condition of your patients, abnormal conditions during the shift, and how it was handled. Was there a med score, abnormal tests, diagnostics, vital signs? How were these handled? Were the potassium, magnesium, pain medicine administered to your patients, blood cultures drawn, antibiotics given, elevated white blood count. We need diagnostics. We will talk about medications given in your handoff. Pre-pain assessment, was it a scale of 10? After your medication was administered, 1 hour later, if it's a oral medication, what was your post-assessment 1 hour later has to be documented. If it was an IV medication, pre-pain assessment, what is your post-assessment after you administered your IV pain medicine 15 minutes later? Pain is the 5th vital sign. Temperature, pulse, respiration, blood pressure. Pain is your 5th vital signs. In your handoff, you'll state what scheduled tests were ordered. What scheduled tests will be done on the incoming nurse's shift. Diagnostics, example, procedures ordered. Is your patient going to OR? X-rays, MRI, dialysis. What is the state of your patients during the previous shift? Was the patient anxious, depressed? Did your patient fall? Is your patient a fall risk? Is your patient forgetful? Oriented ×1. We need to hand off that information to the next nurse. Is your patient NPO? Maybe for OR, let the nurse know. Patient has to be NPO, or else your surgery will have to be rescheduled and the doctors will not be happy. Is your patient NPO because your patient has an NG tube? Handoff, blood transfusion administered into the previous shift. Oncoming nurse, do I need to order to administer blood? Is the consent on the chart? Antibiotics, we'll talk about that in our handoff. TPN, chest tube, G tubes, colostomy, ostomies, will communicate all of that. Is your patient on CPAP? Then we'll communicate last but not least about your discharge planning to home, to nursing home, rehab, discharge planning, length of stay in the hospital, observation less than 24 hours, outpatient can be changed to inpatient if the doctor decides the patient needs to stay greater than 24 hours. In your orientation phase, this is nurse to nurse, preferably at the bedside. There are usually computers at the bedside in most hospitals. Orientation phase, the nurse develop a trusting relationship with your patient. You talk about goals and expectations for the day, plans. Are you going to OR, dialysis, surgery? You talk about, you're trying to build a trusting relationship with your patient. Develop respect for your patient, rules and limitations. We have to set limits, guys. Encourage your patient to express feelings verbally or non-verbally, positive or negative. In this phase, the nurse provides structure, be consistent. In the working phase, identify is the identification phase. In this phase, the working phase, is about the client's problems being identified, solutions explored and applied and evaluated. Termination phase is the resolution phase. The nurse terminates her relationship, and the termination phase begins during the orientation phase. When you go in the mornings, you're knocking at the door, you go in, you pull the screen for privacy, you introduce yourself to the patient. I'm Nurse Pauline. You talk to the patient about preferred name to be called, and you let the patient know my shift begins at 7 a.m. in the morning and it will be terminated at 7:30 p.m. The nurse will be looking forward for you to be leaving at 7:30. You go in about 7 o'clock and make sure the patient is fine, comfortable. Is there anything I can assist you with? You need pain medicine, nausea medication? Because when you're doing a handoff in between shift, that's going to take an hour, unfortunately. Should be half an hour, but sometimes it does not. Just in case the oncoming nurse is late, check with your patient. Is there anything else I can do for you before I leave? The termination phase, the nurse terminates our relationship when mutually agreed goals are met. The patients are discharged home, they are discharged to nursing homes, rehab, some goes to hospice, some goes to another hospital. For some reason, maybe the family is not satisfied with the care or the patient, they'd like to be transferred out from the hospital when a bed becomes available at the other hospital. Please leave your comment below. Please hit your thumbs up button. Please subscribe to my channel. Thank you for joining me today. Please share this video. Stay blessed and study, study, study. Have a great weekend. On Tuesday, I'll return. My next video will be on documentation. Take care.